How are patients billed for anesthesia?
Anesthesia billing is based on two things. Really what we call a base unit, which is really the type of surgery that you're having. The more complicated surgeries, open heart surgery, may have more base units, and then you have a time unit factor in there. So between those two is a combination that goes to the insurance company, and they have it preset to what your bill will be. The other way is, like in our plastics, in our plastic cases here, we'll have some of a preset figure, a preset dollar that we've applied to that. Again, it's sort of based on base and time, but because it's a cosmetic procedure, it's not going to be billed to your insurance company. We work more with the patient and to help them with that on their bill.
Is anesthesia as safe in an ambulatory surgery center as in a hospital?
Definitely. We use the same basic machines. We use the same monitors. We use the same drugs. So everything that you see in this facility, which is a freestanding surgical center, is the same standards as we've got in the hospital.
What if there is a problem during my anesthesia? What safeguards are there to help me?
The training that the anesthesiologists have had, and we operate with an anesthesia care team. So that means we've got a CRNA, we've got a certified registered nurse anesthetist with many years of experience. As a team, we work together on most of our cases. There may be a time later in the day where it's just the anesthesiologist there, but the majority of times you're seeing that team. It's great to have two pairs of hands in one. Just like a pilot, just like flying that airline across the ocean, you got two pilots up there. You know, one may be trained a little more than the other, but it's in a position, if you've got to land that plane, both of you can do that. I always sort of compare it to that. If there's an incident there, you're going to need one, say a person at the head of the bed taking care of certain issues. As I say, you got to have somebody flying the plane. The other issue, you got another pair of hands, say the anesthesiologist, they're giving you different drugs, they're altering what we might be doing. So it's a great backup system as we use that anesthesia care team with an anesthesiologist, board certified, and with a certified registered nurse anesthetist, a CRNA.
A lot of patients have problems with nausea and vomiting after surgery. Are there any ways to decrease the chance of getting sick after surgery?
That's one thing that a lot of patients really worry about with anesthesia, is that I get so sick with anesthesia. And there are patients that do get really sick with anesthesia. A lot of things we've changed in the last decade or so have helped with that. One, again, going back to the propofol that we use to induce you, to put you to sleep, a lot less nausea and vomiting with that. The other is some of the drugs we use. We have like Zofran. You'll see that, we'll use that in our cancer patients, an anti-nausea drug. But we almost routinely use that on our patients. The other is usually we can add some Decadron to that regimen. That's the second line of drug that we can use. The third is we may put a scopolamine patch behind your ear. You'll see this in motion sickness. You ever been on a cruise, or you ride in a car and get a lot of car sickness? This is one of the things that you can do to help with that. The fourth, again, is going back to the old tried and true Phenergan that we've used. We can give it through the IV, we can give you an IM shot, and that's helped. Those four drugs alone sort of cover all the bases where nausea and vomiting comes from. Unfortunately, there's some folks that still get sick after that, but it is very few. And with these drugs that we use, it really helps to cut down the amount of nausea and vomiting we're seeing post-op.
What can a patient do prior to surgery to aid in their surgical experience?
It's very important that the first thing a patient can do getting ready for surgery is not have anything to eat or drink after midnight. There may be some instances where you're not having surgery till 4 o'clock the next afternoon, and we may talk to you about your NPO status, whether you might can have a light breakfast or not. But if there's ever a question, nothing to eat or drink after midnight. And the reason is that is because you don't want the potential of that coming up, going into your lungs getting really sick from that, bad pneumonia. So that's one of the reasons. The other is, if you let us know all the medications you're taking. We'll look at those medications, and there's some that we want you to hold. There's some that we want you to take the morning of. If you're diabetic, there's a couple of things there. So it's important to let us know all your medications there. If there's, and you need to be truthful about your medical issues. There may be something that you don't think is really important, but it is. Everything's important. If you have some cardiology problems, if you've been to see your cardiologist in the last 6 months or so, get us a report from that cardiologist. It is very helpful for us in planning out your anesthetic.
What changes have you noted in the past years that have made anesthesia safer, and what equipment is used to provide a safe anesthetic?
Several things that have come about in the last decade or so in anesthesia. One was the advent of propofol. Propofol is a white milk. You might hear this Michael Jackson milk, something like that. But propofol is a short-acting anesthetic. We give it through the IV. You go to sleep smooth. Sometimes burns a little bit, but then when you wake up, you're a lot clearer. You wake up a lot faster at the end of the case. And so that's one thing that's helped. A couple of things is our anesthetic gases that we're using, a lot smoother. These are gases that don't last a long time in your body. And so again, after surgery, after your anesthetic, you're a lot more awake and alert than you used to be even 10 years ago. Our pulse oximetry. Our pulse oximetry is a little clip that will go on your finger. This little clip here will monitor the amount of oxygen in your bloodstream. Very helpful for us in anesthesia. Besides for monitoring our pulse and our blood pressure, our respirations, we're doing all that at one time. So that really helps.
What can you tell the patients to calm their fears about anesthesia?
Today, anesthesia is safer than ever. Statistics today show that the significant problems with anesthesia, somewhere in the range in healthy patients, 1 in 250,000, 1 in 300,000. So most of our healthy patients here should not fear the problems with anesthesia. We've had numerous advances in anesthesia over the last couple of decades that have increased the safety that we've seen. And so we've looked at things that control our airway. We've looked at like pulse oximetry that monitors the amount of oxygen we have in the bloodstream. We look at our drugs that we use that are shorter, have a lot less nausea. You're able to wake up and not be so sleepy after an anesthetic. So these are just a few of the things that we're seeing nowadays.